Heart disease is the leading cause of death for women in the United States, claiming about 1 in 5 female deaths in 2023. Yet many women do not recognize the early warnings. Research in circulation shows about 95% of women report prodromal symptoms often weeks before a heart attack. But these signs are so quiet, they're dismissed as stress aging or minor issues. The stakes are enormous. Cardiovascular disease kills one woman about every 80 seconds, more than all cancers combined. And women are more likely than men to overlook early symptoms because their patterns often differ from the classic presentation taught for decades. Recognizing these differences and taking subtle clustered symptoms seriously can change outcomes. Before we unpack the 9 life-saving clues, join our Women's Heart Health community. Subscribe, turn on notifications, and tell us where you're watching from. These understated warnings are easy to ignore, but noticing them early can be the difference between urgent care and catastrophe. 1. Chest discomfort. Let's flip the usual order and begin with chest discomfort, because for many women, it does not match the classic image most people carry in their heads. If you learn to think of a heart attack as sudden crushing pain in the center of the chest, that script often fits men better than women. In women, the story is quieter and easier to dismiss, which is one reason it gets missed. Research shows that only about 29.7% of women who go on to have a heart attack report chest discomfort beforehand. Instead of the dramatic vise-like agony described by many men, women more often notice vague sensations that do not feel like pain. They talk about pressure, fullness, tightness, a gentle squeezing, or a sense of heaviness sitting on the chest. Burning is common and easily mistaken for severe heartburn. Because these feelings are mild or ambiguous, they are often blamed on reflux, a strained muscle anxiety, or a stressful day, rather than on the heart. When women do try to put words to it, the vocabulary shifts away from sharp or stabbing pain and toward aching tightness and pressure. Some say it feels as if someone is lightly but persistently pressing a hand against the breastbone. Others describe warmth or burning that creeps across the chest without a clear point of origin. The experience can be uncomfortable without being overwhelming, which makes it deceptively easy to ignore. Biology helps explain the difference. Women typically have smaller coronary arteries than men and are more likely to develop microvascular disease, which affects the tiny vessels that nourish the heart muscle. Those small vessel problems generate different pain signals than the large artery blockages that dominate the classic picture. The result is a symptom profile that is subtler, more diffuse, and less likely to trigger alarm. Another important distinction is timing. Rather than a single bout of relentless severe pain, women often experience chest discomfort that ebbs and flows over days or even weeks. Physical exertion or emotional stress may bring it on, and then it settles down, creating a pattern that looks more like a nuisance than a medical emergency. That stop and start pattern reinforces the impression that nothing serious is happening. The consequences are significant because chest discomfort in women may be muted intermittent or easily attributed to non-cardiac causes. Their heart attacks are more likely to go unrecognized. This muted signal contributes to missed diagnoses and premature discharge from emergency departments, where the absence of dramatic chest pain can be wrongly interpreted as reassurance. Recognizing how women describe and experience chest discomfort is therefore essential to catching cardiac events that might otherwise be overlooked. 2. Sweating without exertion. Continuing this reordered sequence, the next signal is sweating that shows up without effort, often arriving alongside other quiet warnings. If you find yourself breaking into a cold sweat while sitting in an air-conditioned room or becoming drenched during everyday tasks that never used to raise your temperature, treat it as meaningful. This pattern is not simply inconvenient, it is a notable warning sign. Studies report that roughly 39% of women experiencing a heart attack describe cold sweats as an acute symptom. The way women talk about it varies, but the theme is suddenness and mismatch with the situation. Some describe intense hot flash like waves despite not being menopausal. Others recount abrupt cold sweats that seem to appear out of thin air. Many feel clammy and chilled, while at the same time sweating heavily, or they perspire so much during small chores that a change of clothes becomes necessary. There is a physiologic explanation when coronary artery blockages reduce the heart's ability to circulate blood effectively. The body flips on its sympathetic fight or flight response. Stress hormones surge, and sweat glands become overactive. At the same time, poor cardiac output interferes with normal temperature control, so your internal thermostat stops responding as cleanly as it should. The result is sweating that feels disproportionate to the moment. Just as important is the company this symptom keeps. These sweats frequently cluster with other cardiac warnings, creating a chain of signals that can be misread as anxiety, a minor illness, or simple overheating. In reality, they may be part of the early picture of a cardiac event. Many women notice that the threshold for triggering these episodes drops over time, with smaller and smaller prompts bringing on more pronounced sweating. Recognizing that progression and understanding that unexplained sweating can be cardiac in origin helps prevent the misinterpretation that so often delays care. 3. Lightheadedness or dizziness. Continuing the reversed order, turn your attention to lightheadedness and dizziness, a signal that often slips under the radar. That woozy feeling you chalk up to standing too fast may actually be your brain alerting you that blood flow is not keeping up, a consequence of the heart's diminished pumping ability. In clinical reports, about 39% of women who had a heart attack described episodes of lightheadedness or dizziness as acute symptoms. Women portray these episodes in many ways. Some feel as if they might faint during everyday tasks. Others notice a constant unexplained lightheadedness that lingers through the day. There are accounts of the room spinning while sitting perfectly still, or of feeling detached from one's surroundings, as if everything is slightly out of sync. A number of women describe sudden moments when their legs seem to give out and they fear they could collapse without warning. The physiology behind this is straightforward. Your brain uses roughly 1/5 of the body's oxygen supply, making it highly sensitive to any dip in delivery. When coronary artery disease limits the heart's output, cerebral blood flow can falter. Dizziness in this context is not random. It is the brain's distress signal that perfusion is inconsistent and inadequate for normal function. Mislabeling these episodes is common. Many women attribute them to dehydration, low blood sugar, hormonal fluctuations, or simply the passage of time. While those factors can certainly cause dizziness, heart-related episodes often have a recognizable pattern. They may appear during physical effort, accompany shortness of breath, or a sense of pressure in the chest, and evolve from brief mild spells to near fainting, or even true loss of consciousness. Seen in this lightheadedness and dizziness are not minor inconveniences, but prominent early clues in the larger story of cardiac stress. Recognizing the pattern and its companions helps distinguish ordinary wooziness from a heart-driven warning, especially when episodes become more frequent, require less and less activity to trigger or occur, alongside other subtle cardiac symptoms. 4. Anxiety or a sense of doom. Keeping with the inverted sequence, the next early clue is anxiety, or a powerful sense that something terrible is imminent. What feels like a psychological storm can in fact originate in the heart. That overwhelming surge of fear, the conviction that something catastrophic is about to happen, may be your nervous system reacting to a heart that is no longer delivering oxygenated blood reliably to the body. Studies indicate that about 35% of women report unusual anxiety, panic-like sensations, or an inexplicable feeling of impending doom before a heart attack. This experience does not match ordinary worries or everyday stress. Many women describe a sudden belief that they are about to die without any rational explanation for the feeling. Others recount the abrupt onset of claustrophobia or panic attacks, despite having no prior history or a suffocating sense of being trapped, even when life circumstances seem stable and routine. The biology behind this phenomenon is straightforward. The brain depends on a steady stream of oxygen-rich blood to function. When coronary artery blockages reduce the heart's pumping capacity, the brain can receive blood flow that is inconsistent and insufficient. In response, the body flips into a fight or flight state, even though there is no external danger. The autonomic nervous system floods the bloodstream with stress hormones, such as adrenaline and cortisol, which generate the physical sensations people interpret as anxiety. A racing heartbeat, sweating, trembling, and a rising feeling of dread can all result from this internal alarm. Because there is no obvious trigger, the episode feels mysterious and deeply unsettling. That mismatch between intense fear and a calm environment is precisely what makes the symptom easy to dismiss as just anxiety. The danger lies in that dismissal. When the psychological experience is treated as purely emotional, the underlying cardiac strain can be overlooked. Heart-related anxiety in this context has recognizable features. It tends to appear suddenly in women who do not typically struggle with anxiety. It feels qualitatively different from their usual stress responses, and it frequently comes bundled with physical signs. Taken together, these characteristics separate a routine emotional reaction from a body-level warning. Understanding this connection reframes anxiety and a sense of doom as potential signals of impaired cardiac output, rather than isolated mood events. Recognizing the pattern, especially when it surfaces out of the blue and is accompanied by bodily symptoms, helps bring a concealed cardiac problem into focus before it escalates. 5. Nausea or indigestion. Staying with the reverse sequence, nausea or indigestion belongs near the top of the watch list. That stubborn stomach churn you keep treating with antacids may be less about your gut and more about your heart sounding an urgent alarm. Research indicates that about 39% of women reported nausea, indigestion, or abdominal discomfort in the weeks leading up to a cardiac event. Yet most initially assume the problem was purely digestive. The lived experience often feels misleading. Many women describe a lingering queasiness with no obvious trigger or what seems like the worst indigestion of their lives that refuses to improve with the usual remedies. Others talk about a nervous, unsettled stomach that never fully calms, or a puzzling sense of fullness that has nothing to do with recent meals. Because these sensations are familiar and common, they are easy to chalk up to food choices, mild infection, or stress. There is a direct physiologic link that explains this confusion. The heart and the gastrointestinal system communicate through the vagus nerve and related neural pathways. When the heart muscle is starved of oxygen due to narrowed coronary arteries, distress signals can travel along these circuits and be perceived as gastrointestinal upset. In other words, cardiac strain can be translated by the body into what feels like a stomach problem. Patterns offer important clues. Heart-related nausea or indigestion often appears with physical effort or during emotional stress. It does not follow the predictable rhythm of meal-related reflux and may arrive out of sync with eating. These episodes frequently cluster with other subtle warnings such as unusual fatigue or shortness of breath, which further distinguishes them from routine heartburn. A final trap makes this symptom particularly risky. Medications that reduce acid can sometimes blunt the discomfort for a short time, creating the illusion that the issue has been solved. Temporary relief, however, does not mean the underlying cause is benign. When indigestion-like symptoms persist, escalate with minor exertion, or come packaged with breathlessness and fatigue, they may reflect the heart's declining ability to supply steady blood flow. Reframing nausea and indigestion in this way helps prevent misinterpretation. Persistent or atypical stomach symptoms, especially those that resist standard treatments and break the usual connection to meals, deserve attention as potential cardiac signals rather than being dismissed as everyday digestive complaints. 6. Jaw, neck, or back pain. Placed next in this reversed order is pain in the jaw, neck, or back, a signal that is often misinterpreted. The nagging jaw soreness you blame on nighttime grinding, or the stiff neck you attribute to slouching, may in fact be your heart asking for attention. What feels like a routine muscle or dental issue can reflect an underlying cardiac problem that is easy to overlook. Research consistently shows that during a heart attack, women are more likely than men to identify jaw, neck, or back discomfort as their main symptom. The sensation they describe is not the sharp pinpoint pain of an acute injury. It is a deep ache, a heavy pressure, a diffuse discomfort that seems to spread from a place that is hard to identify. Many recount the worst stiff neck they have ever had, or a relentless jaw ache that mimics hours of clenching even when they have not done so. There is a physiologic reason for this confusing presentation. The heart and the upper body share nerve pathways through the vagus nerve and related networks. When coronary arteries are narrowed and the heart muscle is short on oxygen, distress signals can be routed along those shared circuits. The result is pain that is perceived in the jaw, neck, or back, rather than directly over the chest. In effect, the body's wiring is relaying the heart's alarm through neighboring channels. The pattern of this discomfort adds to the confusion. It often waxes and wanes, which encourages people to write it off as stress tension, a strained muscle, or a minor dental problem. Many women spend days or weeks trying mouth guards, posture fixes, or anti-inflammatory creams, while the cardiac issue quietly advances. Because the symptom does not behave like a dramatic emergency, it is easy to minimize. Heart-related jaw, neck, or back pain commonly appears with physical effort and eases with rest. It also tends to travel with other subtle warnings, such as unusual fatigue or unexplained sweating. Taken together, these clues argue for a cardiac source rather than a simple musculoskeletal or dental cause. Recognizing this cluster and the exertional pattern helps reframe a familiar ache as a potential sign of reduced blood flow to the heart. 7. Shortness of breath. As we approach the beginning of the original sequence, shortness of breath moves into focus precisely because it is so easy to shrug off. Becoming winded by everyday tasks that once felt effortless is not simply being out of shape. Evidence shows that 42.1% of women experience breathing difficulties in the month before a cardiac event. In fact, this symptom appears roughly twice as often in women as in men ahead of a heart attack. Yet women are far more likely to minimize it. The presentation is subtle instead of dramatic. Gasping. Many women describe an unsatisfying breath as if they cannot fill their lungs completely even at rest. Some find themselves consciously managing their breathing, something that should happen automatically. Ordinary activities that never used to register now feel like a workout, leaving them inexplicably winded. The physiology is straightforward blocked. Coronary arteries limit the heart's ability to propel oxygenated blood through the body. When tissues are undersupplied, the brain attempts a quick fix by driving faster, shallower respirations. But no volume of quick breaths can compensate for a pump that is underperforming. That is why heart-related shortness of breath tends to intensify with minimal exertion, fails to resolve the way normal exercise breathlessness does after rest, and often travels with other clues, such as unusual fatigue or a sense of pressure in the chest. Left unrecognized, a mild feeling of air hunger can advance to breathlessness even while sitting still. That progression is the point of danger, and the reason early recognition matters. Reframing shortness of breath as a potential marker of reduced cardiac output, especially when it appears out of proportion to activity, resists recovery. With rest in clusters, with fatigue or chest discomfort, helps distinguish a benign nuisance from a developing cardiac emergency. 8. Sleep disturbances. Near the start of the original lineup come sleep disturbances which deserve attention precisely because they're easy to chalk up to stress or busy routines. In many women, restless nights function as an early alarm from the cardiovascular system rather than a simple insomnia problem. Evidence suggests that about 47.8% of women who later suffered a heart attack noticed disrupted sleep in the weeks or months beforehand. In one Heart and Lung Journal study of 270 women experiencing a first heart attack, 632 reported new or worsening sleep problems leading up to the event. What women describe does not sound like ordinary tossing and turning. Many lie awake with the unsettling sense that their heart is working unusually hard even in the quiet of night. Others feel an unexplained agitation that keeps them from sinking into deep restorative sleep. Some wake suddenly short of breath or struggling to take a satisfying breath. Still others find themselves wide alert during hours when they would normally be sleeping soundly without any obvious reason. The physiology ties back to blood flow. As coronary arteries narrow, the heart can struggle to maintain adequate circulation during rest. The nervous system detects that something is wrong and shifts the body into a heightened state of vigilance. You are not consciously choosing to stay awake. A primitive survival mechanism is nudging you toward wakefulness because it senses underlying cardiovascular strain. Heart-related sleep disturbances have a recognizable flavor. They feel more intense than a typical bad night may ride along with sweating or breathlessness, and stubbornly ignore standard sleep hygiene strategies. When poor sleep arrives in this pattern and lingers despite good habits, it points beyond ordinary insomnia to the possibility of reduced cardiac output, disturbing the night's normal calm. Recognizing this connection reframes sleep trouble as a potential cardiologic signal worthy of prompt attention rather than a nuisance to be managed with over-the-counter fixes. 9. Unusual fatigue. Closing the reversed lineup is unusual fatigue, which belongs at the top of concerns even when it feels like the least dramatic symptom. The crushing weariness you've chalked up to a packed schedule or a bad week may actually be a distress call from your heart. This isn't ordinary tiredness after a long day. It's a profound energy-sapping exhaustion that turns routine chores into uphill climbs and makes previously simple tasks feel unmanageable. A landmark investigation published in Circulation followed 515 women who had suffered heart attacks and uncovered a striking pattern. Fully 70.7% reported experiencing unusual, overwhelming fatigue in the weeks preceding their cardiac event. In the words documented by the research team led by Dr. Jean Mouini at the University of Arkansas for Medical Sciences, many women felt as though they could not make a bed without stopping to rest, or were too drained to prepare dinner, signals that daily living itself had become burdensome. There is a clear physiologic logic behind this. As plaque narrows the coronary arteries, the heart must push harder to circulate oxygenated blood. That extra workload steals reserve from every organ system that depends on a steady delivery of oxygen and nutrients. The result is whole body depletion. Muscles feel heavy, concentration fades, and even after lying down, you may rise with the same bone-deep fatigue you had before. Rest offers little relief because the underlying pump problem remains. What makes this warning particularly treacherous is how often women are socialized to treat exhaustion as normal. Responsibilities pile up, and tiredness becomes the default explanation. But the fatigue tied to cardiac strain has a distinct character. It is unexplained by your recent activity level, it interferes with ordinary self-care and household tasks, and it lingers despite attempts to catch up on sleep. Many women also describe a steady background sense that something fundamental in their body has shifted even if they cannot name it. Seen through this lens, persistent out-of-proportion fatigue is not a minor nuisance, but a potential early alert from the cardiovascular system. When overwhelming tiredness arrives without a clear cause, resists rest, and disrupts daily routines, particularly in the presence of other risk factors or subtle companion symptoms, it may be your body's earliest, most insistent signal that the heart is working too hard and not keeping up. Up to 95% of women report subtle warning symptoms weeks before a heart attack, often misread as stress aging or minor issues. These signs usually cluster together and represent a change from your normal, unusual fatigue, sleep trouble, breathlessness, chest pressure, nausea, indigestion, cold sweats, dizziness, anxiety, or doom, and jaw, neck, back pain. If several appear at once, trust your instincts and demand a cardiac evaluation, especially with risk factors like high blood pressure, high cholesterol, diabetes, smoking, excess weight, or family history. Share this with every woman. If this helped you, comment. Helpful, like share and subscribe for more life-saving content. Your heart is worth listening to.